Diabetes. Woman checking her blood sugar levels. Jump to. What is diabetes? Types and risk factors. Type 1 diabetes. Latent autoimmune diabetes of adults, LADA. Gestational diabetes. Prediabetes. Type 2 diabetes. Type 2 diabetes and prediabetes can be prevented. Definition and overview. Our cells depend on a single simple sugar, glucose, for most of their energy needs. The body has intricate mechanisms in place to make sure glucose levels in the blood don't go too low or soar too high. When you eat, most digestible carbohydrates are converted into glucose and quickly absorbed into the bloodstream. Any rise in blood sugar signals the pancreas to make and release the hormone insulin, which instructs cells to sponge up glucose. Without insulin, glucose floats around the bloodstream, unable to slip inside the cells that need it for energy. Diabetes mellitus is a condition of abnormally high levels of glucose in the blood because either the body is not making enough insulin or can't properly use the insulin it makes. Normally, blood glucose rises after eating a meal but then drops in 1 to 2 hours as the glucose is shuttled out of the blood and into cells. In people with diabetes, their blood glucose may remain elevated for several hours. Their blood glucose may also rise much higher after eating a meal than someone who does not have diabetes. What is hypoglycemia? There are different types of diabetes, including prediabetes, type 1 diabetes, type 2 diabetes, latent autoimmune diabetes, and gestational diabetes. The most common types in the US are prediabetes and type 2 diabetes, which are largely influenced by carrying excess body fat, a poor diet, and lack of exercise. Almost 30 million Americans have diabetes. Of those, about 7 million don't know they have the disease. About 84 million adults have a condition called prediabetes that is a precursor to full-blown diabetes. In 2017, the total estimated cost of diagnosed cases of diabetes in the U.S. was $327 billion, including direct medical costs and reduced productivity. If the spread of type 2 diabetes continues at its present rate, the number of people diagnosed with diabetes in the United States will increase to about 48 million in 2050. Worldwide, the number of adults with diabetes will rise to 439 million in the year 2030. 3. Secondary health problems stemming from diabetes are equally alarming. High blood glucose levels can damage organs and tissues. Diabetes is the leading cause of blindness and kidney failure among adults. It causes mild to severe nerve damage that, coupled with diabetes-related circulation problems, often leads to the loss of a leg or foot. Diabetes significantly increases the risk of cardiovascular disease, including heart attacks and strokes. It is the 7th leading cause of death in the U.S., directly causing almost 80,000 deaths each year and contributing to thousands more. 5. Types of diabetes. Type 1 diabetes mellitus. Latent autoimmune diabetes of adults, LADA. Gestational diabetes mellitus. Prediabetes. Type 2 diabetes mellitus. Type 2 diabetes and prediabetes can be prevented. Type 2 diabetes, once called adult-onset diabetes, is striking an ever-growing number of adults. Even more alarming, it is now showing up in teenagers and children. With the rising rates of childhood obesity, it has become more common in youth, especially among certain ethnic groups. In the U.S., the Search for Diabetes in Youth study found that type 2 diabetes accounted for only 6% of new diabetes cases in non-Hispanic white children ages 10 to 19, but anywhere from 22 to 76% of new cases in other ethnic groups, 8. The highest rates were found in Asia-Pacific Islander and Native American youth. Although the genes you inherit may influence the development of type 2 diabetes, they take a back seat to behavioral and lifestyle factors. Data from the Nurses' Health Study suggest that 90% of type 2 diabetes in women can be attributed to 5 such factors: excess weight, lack of exercise, a less than healthy diet, smoking, and abstaining from alcohol. 13. Among 85,000 married female nurses, 3,300 developed type 2 diabetes over a 16-year period. Women in the low-risk group were 90% less likely to have developed diabetes than the rest of the women. Low risk meant a healthy weight, body mass index less than 25, a healthy diet, 30 minutes or more of exercise daily, no smoking, and having about 3 alcoholic drinks per week. Similar factors are at work in men. Data from the Health Professionals Follow-up Study indicate that a Western diet, combined with lack of physical activity and excess weight, dramatically increases the risk of type 2 diabetes in men. 14. Information from several clinical trials strongly supports the idea that type 2 diabetes is preventable. The Diabetes Prevention Program examined the effect of weight loss and increased exercise on the development of type 2 diabetes among men and women with high blood sugar readings that hadn't yet crossed the line to diabetes. In the group assigned to weight loss and exercise, there were 58% fewer cases of diabetes after almost 3 years than in the group assigned to usual care. 15. Even after the program to promote lifestyle changes ended, the benefits persisted. The risk of diabetes was reduced, albeit to a lesser degree, over 10 years. 16. Similar results were seen in a Finnish study of weight loss, exercise, and dietary change, and in a Chinese study of exercise and dietary change. 17 to 20. Is diabetes reversible? Is it possible to reverse or cure diabetes? The answer is maybe. When someone reports that they have reversed their diabetes, this actually means that they were able to stop using diabetes medication after making healthy lifestyle changes, such as losing weight, following a healthful diet, and exercising. If prediabetes, type 2 diabetes, or gestational diabetes is detected early in an individual who immediately initiates healthy lifestyle changes, it may be possible to reverse or at least stop the progression of the disease. However, if these types of diabetes are not diagnosed early or are not well controlled for a long period, the cells of the pancreas can become permanently damaged so that they no longer produce insulin. If this happens, chances are higher that diet and exercise alone may no longer be effective in controlling the diabetes and lifelong medication may be needed. The same is true with type 1 diabetes and LADA, in which the pancreas already does not make enough insulin. With these conditions, the diabetes can be managed but not reversed. The good news is that type 2 diabetes, as well as prediabetes, are largely preventable. About 9 in 10 cases in the US can be avoided by healthy lifestyle practices, including controlling your weight, following a healthy diet, staying active, and not smoking. Simple steps to preventing diabetes. Medical conditions: diabetes and cholesterol checked on a medical test result form. Keeping weight in check, being active, and eating a healthy diet can help prevent most cases of type 2 diabetes. Overview. If type 2 diabetes were an infectious disease, passed from one person to another, public health officials would say we're in the midst of an epidemic. This difficult disease is striking an ever-growing number of adults, and with the rising rates of childhood obesity, it has become more common in youth, especially among certain ethnic groups. Learn more about diabetes, including the other types and risk factors. The good news is that prediabetes and type 2 diabetes are largely preventable. About 9 in 10 cases in the US can be avoided by making lifestyle changes. These same changes can also lower the chances of developing heart disease and some cancers. The key to prevention can be boiled down to 5 words: stay lean and stay active. What if I already have diabetes? Guidelines for preventing or lowering your risk of developing type 2 diabetes are also appropriate if you currently have a diabetes diagnosis. Achieving a healthy weight, eating a balanced carbohydrate-controlled diet, and getting regular exercise all help to improve blood glucose control. If you are taking insulin medication, you may need more or less carbohydrate at a meal or snack to ensure a healthy blood glucose range. There may also be special dietary needs for exercise, such as bringing a snack so that your blood glucose does not drop too low. For specific guidance on scenarios such as these, refer to your diabetes care team, who are the best resources for managing your type of diabetes. Simple steps to lowering your risk. Control your weight. Excess weight is the single most important cause of type 2 diabetes. Being overweight increases the chances of developing type 2 diabetes 7-fold. Being obese makes you 20 to 40 times more likely to develop diabetes than someone with a healthy weight. 1. Losing weight can help if your weight is above the healthy weight range. Losing 7 to 10% of your current weight can cut your chances of developing type 2 diabetes in half. Get moving and turn off the television. Inactivity promotes type 2 diabetes. 2. Working your muscles more often and making them work harder improves their ability to use insulin and absorb glucose. This puts less stress on your insulin-making cells. So trade some of your sit time for fit time. Long bouts of hot, sweaty exercise aren't necessary to reap this benefit. Findings from the Nurses' Health Study and Health Professionals Follow-Up Study suggest that walking briskly for a half hour every day reduces the risk of developing type 2 diabetes by 30%. 3. 4. More recently, the Black Women's Health Study reported similar diabetes prevention benefits for brisk walking of more than 5 hours per week. 5. This amount of exercise has a variety of other benefits as well. And even greater cardiovascular and other advantages can be attained by more and more intense exercise. Television watching appears to be an especially detrimental form of inactivity. Every 2 hours you spend watching TV instead of pursuing something more active increases the chances of developing diabetes by 20%. It also increases the risk of heart disease, 15%, and early death, 13%. 6. The more television people watch, the more likely they are to be overweight or obese, and this seems to explain part of the TV viewing diabetes link. The unhealthy diet patterns associated with TV watching may also explain some of this relationship. Tune up your diet. For dietary changes can have a big impact on the risk of type 2 diabetes. 1. Choose whole grains and whole grain products over refined grains and other highly processed carbohydrates. 2. Skip the sugary drinks and choose water, coffee, or tea instead. 3. Choose healthy fats. 4. Limit red meat and avoid processed meat. Choose nuts, beans, whole grains, poultry, or fish instead. Don't smoke. Add type 2 diabetes to the long list of health problems linked with smoking. Smokers are roughly 50% more likely to develop diabetes than non-smokers, and heavy smokers have an even higher risk. 33. Light to moderate alcohol consumption. Evidence has consistently linked moderate alcohol consumption with reduced risk of heart disease. The same may be true for type 2 diabetes. Moderate amounts of alcohol, up to a drink a day for women, up to 2 drinks a day for men, increases the efficiency of insulin at getting glucose inside cells. And some studies indicate that moderate alcohol consumption decreases the risk of type 2 diabetes. 1. 34 to 39, but excess alcohol intake actually increases the risk. If you already drink alcohol, the key is to keep your consumption in the moderate range, as higher amounts of alcohol could increase diabetes risk. 40. If you don't drink alcohol, there's no need to start. You can get the same benefits by losing weight, exercising more, and changing your eating patterns. Beyond individual behavior. Type 2 diabetes is largely preventable by taking several simple steps: keeping weight under control, exercising more, eating a healthy diet, and not smoking. Yet it is clear that the burden of behavior change cannot fall entirely on individuals. Families, schools, worksites, healthcare providers, communities, media, the food industry, and government must work together to make healthy choices easy choices. For links to evidence-based guidelines, research reports, and other resources for action, visit our Diabetes Prevention Toolkit. Related. Diabetes, Overview, Types, and Risk Factors. Asian Diabetes Prevention Initiative. Definition and Overview. Cancer is a disease in which abnormal cells divide and grow out of control, destroying healthy surrounding tissue. Normal healthy cells in the body follow certain rules, growing and dividing in an orderly fashion. Eventually they die and are replaced with new cells. But sometimes old or damaged cells do not die and form an abnormal mass of tissue called a tumor. Tumors may be benign, meaning that they do not invade nearby healthy tissue. But sometimes they are malignant, in which genes in the cells deviate, causing them to grow and divide erratically and spread into nearby tissues. As cancer cells continue to grow, they may break off from the original growth and travel through the blood or lymph fluid to other parts of the body. Genetic changes can be inherited, or the result of DNA damage caused by external exposures like excessive ultraviolet light or carcinogens like tobacco smoke. The global burden of cancer is rising alongside the world's aging population. 1 in 5 men and 1 in 6 women worldwide develop some type of cancer during their lifetime, and 1 in 8 men and 1 in 11 women die from the disease. 1. Cancer also takes a huge economic toll. A report from the World Economic Forum and the Harvard T.H. Chan School of Public Health projected that the global cost of cancer, including medical costs, non-medical costs, and income losses, will total an estimated US $458 billion in 2030. 2. A cancer diagnosis can also place a heavy toll on the patient and their family. Fortunately, with screening and early detection, as well as ongoing development of cancer treatments, people diagnosed with cancer are living longer than before. Even better is that many cases of cancer are preventable through a range of lifestyle changes, which may also prevent other common chronic conditions like cardiovascular disease and type 2 diabetes. Types and risk factors. Cancer is not just one disease. There are more than 100 types, which can start anywhere in the body. They are named by the organ or tissue in which they start growing. They can form in organs, bones, muscles, tendons, fat, blood vessels, and lymph fluid. Examples of more common types include carcinoma. This is the most common type, which forms a solid mass of tissue, tumor. Breast, lung, and colorectal cancer are types of carcinomas. Leukemia. This cancer starts in the blood, occurring when large numbers of abnormal white blood cells build up in the blood and bone, crowding out healthy blood cells. A lack of healthy blood cells can lower one's immune function, increasing the risk of frequent infections, fatigue, and recurrent bruising or bleeding. Lymphoma. This cancer arises in lymphocytes, a type of white blood cell. Lymphocytes normally fight infection, but here they grow out of control. This can cause swollen lymph nodes, shortness of breath, and fatigue. The figures below, click to enlarge, show the estimated number of new cancer cases and deaths worldwide in 2020, classified by the cancer site. 3. Lung cancer contributes to the greatest number of new cancer cases in women and men combined. However, in women, breast cancer contributes to more new cases, and slightly edges out lung cancer as the leading cause of cancer deaths. In men, lung cancer contributes the greatest number of new cases, followed by prostate cancer, and is the leading cause of cancer deaths. Other common cancers include those of the colon and rectum, stomach, liver, pancreas, esophagus, and cervix, which, together with lung, breast, and prostate cancer account for over half of all cancer cases and deaths worldwide. The other 46% of cases and 39.5% of deaths are from a variety of other types of cancer, such as skin cancer. Learn more about cancer prevalence in this interactive tool from the International Agency for Research on Cancer. Beyond the classification of cancer by site, tumors originating from the same tissue can have different features, a distinction which can help decide the most effective treatment. For example, tumors in breast tissue have several different subtypes defined by hormone receptors, such as estrogen receptors, ER. ER-positive breast tumor cells grow in response to estrogen, and thus are more likely to be treated successfully using anti-estrogen hormone therapy than ER-negative tumor cells. Primary lung cancer is divided into two main groups, small cell lung cancer and non-small cell lung cancer. Both types behave and respond to treatment in a similar way. But small cell lung cancer is rarer and requires more immediate treatment because it tends to grow faster and spread early. The more common non-small cell lung cancer tends to develop slowly and causes fewer symptoms before it reaches later stages. However, cancer cells also have in common a range of abnormal features. 4. They ignore signals to stop dividing, quickly replicate, escape detection by the body's immune cells, and invade normal tissues. Cancer cells cause nearby normal cells to form blood vessels that supply the tumor with oxygen and nutrients, which is needed to grow. Figure 4. Diet, nutrition and physical activity, other environmental exposures, and host factors interact to affect the cancer process. This material has been reproduced from the World Cancer Research Fund/American Institute for Cancer Research. Diet, nutrition, physical activity and cancer, a global perspective. Continuous Update Project Expert Report 2018. Available at diet10cancerreport.org. All cells are exposed to genetic changes that can cause cancer, but they have mechanisms to repair damage to genes and protect themselves against these hallmarks of cancer. 5. However, due to factors like aging, the environment, example, UV radiation, and lifestyle, example, poor diet, smoking, the protective mechanisms sometimes fail, leading to an increased risk of cancer development. Prevention. Because each person is exposed to unique environmental and lifestyle factors, the risk of developing cancer can vary. Although some of the risk factors cannot be controlled, such as inherited genetic mutations, there is a range of environmental and lifestyle risk factors that can be modified. Taking preventive measures can reduce the overall risk of cancer by 30 to 50%, which varies depending on the cancer's site of origin. 6. Screening. Cancer screening tests look for evidence of cancer cells or abnormal cells that may become cancer in people who do not show any symptoms. This helps to catch and remove a precancer lesion and avert the cancer, or treat a potential cancer early, before it grows or spreads and causes symptoms, and which may be easier to treat. Examples of screening tests that lower the risk of dying early from cancer include colonoscopy, sigmoidoscopy, or stool tests for colorectal cancer. Mammography for breast cancer. Human papillomavirus, HPV, or Pap tests for cervical cancer. PSA tests for prostate cancer. Skin exams for skin cancer, particularly in those at higher risk for skin cancer, such as having a prior skin cancer. Low-dose helical computed tomography for lung cancer, especially in people who smoke and are older than 55 years. However, there are sometimes downsides to screening. Individuals should discuss the pros and cons of screening tests with their doctor. Screening tests can have false positive results, a finding that suggests cancer even though it is not, which may mean undergoing additional tests and procedures and causing increased anxiety in the patient. Screening tests can have false negative results, a finding that does not find cancer even though it is present, that can delay an accurate diagnosis and earlier treatment. A result from a screening test may lead to overtreatment of the cancer. In other words, even though a cancer may be accurately found, the type may be very slow-growing so that immediate aggressive cancer treatments are not needed though they may be prescribed. Vaccines. Vaccinations can prevent a few types of cancer caused by prolonged infection from specific pathogens. The human papillomavirus, HPV, vaccine is recommended for females ages 9 to 26 years old and males 9 to 21 years old. It protects against the HPV types that most often cause cervical, vaginal, vulvar, and anal cancers. 7. The hepatitis B vaccine is available for all age groups to prevent the hepatitis B virus, HBV, infection, which causes hepatitis B, a serious chronic illness that can lead to liver cancer. 8. Vaccines targeting other cancer-causing viruses, example Epstein-Barr virus, are under development, but it is emphasized that vaccination should not be a substitute for routine screening according to recommended guidelines. 9. 10. Lifestyle recommendations. According to the World Health Organization, a 30 to 40% cancer burden can be attributed to lifestyle risk factors such as tobacco smoking, alcohol consumption, a diet low in fruit and vegetables, overweight and obesity, and physical inactivity. 6. That's why a lifestyle consisting of a healthy dietary pattern, weight management, and physical activity may help reduce the risk of cancer. Preventing cancer. Although 1 in 5 men and 1 in 6 women worldwide develop some type of cancer during their lifetime, those diagnosed are living longer than ever, thanks to screening and early detection, vaccinations, and improvements in treatment. However, even for cancers with effective treatment options, prevention has the greatest potential to reduce the burden of cancer in the general population. 1. Because each person is exposed to unique environmental and lifestyle factors, cancer risk can vary. Although some factors cannot be controlled, such as inherited genetic mutations, there is a range of modifiable environmental and lifestyle factors that can help reduce the risk of developing cancer. According to the World Health Organization, WHO, a 30 to 40% cancer burden can be attributed to lifestyle risk factors such as tobacco smoking, alcohol consumption, a diet low in fruit and vegetables, overweight and obesity, and physical inactivity. 2. In a 2018 report by the World Cancer Research Fund, WCRF, and the American Institute of Cancer Research, AICR, not-for-profit organizations that lead a network of cancer prevention charities with a global reach, 10 cancer prevention recommendations on diet and nutrition were developed. These recommendations were based on the Continuous Update Project of Evidence in Cancer Research, which summarizes current evidence with relevant papers from randomized controlled trials and cohort studies. 3. Taken together, they promote a lifestyle consisting of a healthy dietary pattern, physical activity, and weight management. This may not only help reduce the risk of cancer but may also contribute to the prevention of obesity and other chronic diseases such as type 2 diabetes and cardiovascular disease. Here is a closer look at some of their recommendations. Maintain a healthy weight. In a meta-analysis conducted by the WCRF/AICR, there is convincing evidence that carrying extra fat mass, marked by a higher body mass index, BMI, greater waist circumference, and greater waist-to-hip ratio, significantly increases the risk of several cancers. 4. BMI measures one's weight in relation to height. A BMI between May 18, 25 is classified as normal, 25.1 to 29.9 overweight, and 30 or higher obese. Each increase of 5 points in BMI was associated with a 50% higher risk of endometrial cancer, 48% higher risk of esophageal adenocarcinoma, 30% higher risk of kidney cancer, 30% higher risk of liver cancer, 12% higher risk for postmenopausal breast cancer, 10% higher risk of pancreatic cancer, and 5% higher risk of colorectal cancer. Each 4-inch increase in waist circumference was shown to increase the risk of esophageal adenocarcinoma by 34%, pancreatic cancer by 11%, postmenopausal breast cancer by 11%, kidney cancer by 11%, endometrial cancer by 5%, and colorectal cancer by 2%. A waist-to-hip ratio, WHR, measures one's waist size divided by hip size. People who carry more weight in the belly, apple shape, are at higher risk for cancer and other chronic diseases than those who carry more weight in the hips, pear shape. The WHO recommends a healthy WHR to be 0.9 or less in men and 0.85 or less in women. Each 0.1 unit increase in waist-hip ratio significantly increased the risk of esophageal adenocarcinoma by 38%, kidney cancer by 26%, endometrial cancer by 21%, pancreatic cancer by 19%, postmenopausal breast cancer by 10%, and colorectal cancer by 2%. Significant increasing weight in adult life is a convincing cause of postmenopausal breast cancer and endometrial cancer. Each 11-pound increase in weight gain during adulthood was significantly associated with a 16% higher risk of endometrial cancer and 6% higher risk of postmenopausal breast cancer. Incidence of obesity-related cancers is also rising in young adults. Researchers from the American Cancer Society collected data from 25 state cancer registries for people ages 25 to 84 years diagnosed with any cancer from 1995 to 2014. Over this time period, incidence rates of several obesity-related cancers, including colorectal, kidney, and pancreatic, increased significantly in the youngest age group, ages 25 to 49 years, with the sharpest increases in progressively younger ages. Although the incidence of these cancers also rose in older age groups, the rate of increase was much smaller. Be physically active. Woman running on road at sunrise. Physical activity is defined as any movement that uses skeletal muscles and requires more energy than does resting. Physical activity can include working, exercising, performing household chores, and leisure time activities such as walking, jogging, running, yoga, hiking, bicycling, and swimming. There is evidence from a 2009 meta-analysis of 52 epidemiologic studies showing that the most physically active individuals had a 24% lower risk of colon cancer than those who were the least physically active. A 2013 meta-analysis of 31 prospective studies showed that the average breast cancer risk reduction associated with physical activity was 12%, and the protective effect was stronger for postmenopausal women. After menopause, women who increase their physical activity may also have a lower risk of breast cancer than women who do not. 8. Sedentary behaviors, such as spending an extended amount of time sitting, reclining, or lying down, may also increase cancer risk. 9. The review of research on sedentary behavior and risk of endometrial, colon, and lung cancers found that the highest versus lowest levels of sedentary time increased risks of these cancers by a statistically significant range of 20 to 35%. 10. Eat a healthful diet. A fork in a dinner bowl of quinoa, salad, radishes, cucumbers. An overall healthy dietary pattern has the potential to lower cancer risk by 10 to 20%. 11. The association between diet and cancer incidence varies by cancer sites and also by sex. 12. But the recommended components of a healthy diet are often similar. The WCRF/AICR listed the following dietary recommendations to protect against cancer. Limit alcohol consumption. 13. There is strong evidence that consumption of alcoholic drinks is a cause of cancers of the mouth, pharynx and larynx, esophagus, squamous cell carcinoma, liver, colorectum, and breast, particularly postmenopause. Every 10 grams of alcohol, as ethanol, consumed per day elevated the risks of these cancers by 4 to 25%. The evidence shows that alcoholic drinks of all types have a similar impact on cancer risk. This recommendation therefore covers all types of alcoholic drinks, whether beer, wine, spirits, liquors, or any other alcoholic drinks, as well as other alcohol sources. Eat a diet rich in whole grains, vegetables, fruit, and beans. 14. Make whole grains, vegetables, fruit, and pulses, legumes, such as beans and lentils a major part of your daily diet. There is strong evidence that eating whole grains protects against colorectal cancer, and that eating foods containing dietary fiber protects against colorectal cancer, weight gain, overweight, and obesity, which, as described above, increases the risk of many cancers. Limit fast foods. 15. Fast foods are readily available convenience foods that tend to be energy-dense and are often consumed in large portions. Most of the evidence on fast foods is from studies looking at burgers, fried chicken, French fries, and high-calorie drinks, containing sugar, such as soda, or unhealthy fats, such as shakes. There is strong evidence that diets containing higher amounts of fast foods and other processed foods high in unhealthy fats, starches, or sugars, as well as consuming a Western-type diet, characterized by a high amount of added sugars, meat, and fat, are causes of weight gain, overweight, and obesity, which are a risk factor for many cancers. Limit red and processed meat. 16. 17. Red meat includes all types of muscle meat from a mammal, including beef, veal, pork, lamb, mutton, horse, and goat. Processed meat has been transformed through salting, curing, fermentation, smoking, or other processes to enhance flavor or improve preservation. Although these products are often made from red meat, i.e., ham, salami, bacon, and some sausages such as frankfurters and chorizo, other meats can also be processed, i.e., turkey bacon, chicken sausage, and deli-sliced chicken. While both red and processed meat were suggested to increase the risk of a number of other cancers, the evidence was most convincing for colorectal cancer. The risk of colorectal cancer increased by 16% with every 50 g/day of processed meat intake, and by 12% with every 100 g/day of red meat intake. Because meat can be a valuable source of nutrients, in particular protein, iron, zinc, and vitamin B12, the recommendation is to limit rather than completely avoid minimally processed red meat. However, poultry and seafood are generally healthier sources of protein as well as many of these other nutrients. Very little, if any, processed meat should be consumed. Limit sugar-sweetened drinks. 18. There is convincing evidence that sugar-sweetened drinks is a cause of weight gain, overweight, and obesity in both children and adults, especially when consumed frequently or in large portions. As noted above, obesity increases the risk of many cancers. Avoiding tobacco and excess sun exposure. The recommendations also emphasize that not smoking and avoiding other exposure to tobacco and excess sun are also important in reducing cancer risk. Cancer survivorship. With improved early detection and availability of more advanced treatment options, people diagnosed with cancer are living much longer. Research on the effects of diet, nutrition, and physical activity on the risk of cancer in cancer survivors is growing, but much more limited than that on risk. Therefore, the lifestyle recommendations mentioned above emphasize that all cancer survivors should receive nutritional care and physical activity guidance from trained professionals. Although evidence is not strong enough to reach firm conclusions, there are indications of links between lifestyle factors and cancer survivorship with improved quality of life and longer survival, especially for more common cancers. For example, maintaining a healthy weight, being physically active, eating foods containing fiber, and having a lower intake of saturated fat appear to lead to better survival after a breast cancer diagnosis. 14. Unless otherwise advised, and if they can, all cancer patients and survivors are advised to follow the WCRF/AICR cancer prevention recommendations as long as possible after the acute stage of treatment. These recommendations are also helpful for managing or preventing other chronic diseases after a cancer diagnosis. A study of survivors of the 20 most common cancers revealed that, even after controlling for the overlapped risk factors for cancer and cardiovascular disease such as excessive weight and smoking, survivors of most site-specific cancers had an increased risk for cardiovascular diseases compared with that of the general population. 15. Evidence has shown that certain cancer treatments, for example anthracycline and trastuzumab, can lead to a higher risk of disease and death from cardiovascular complications. 16 to 18. Oral health. A person with healthy teeth biting into a red apple. There is no health without oral health. You may have heard this statement, but what does it mean? The health of our mouth, or oral health, is more important than many of us may realize. It is a key indicator of overall health, which is essential to our well-being and quality of life. Although preventable to a great extent, untreated tooth decay, or cavities, is the most common health condition worldwide. When we think about the potential consequences of untreated oral diseases including pain, reduced quality of life, lost school days, disruption to family life, and decreased work productivity, making sure our mouths stay healthy is incredibly important. 1. What is a healthy mouth? The mouth, also called the oral cavity, starts at the lips and ends at the throat. A healthy mouth and well-functioning teeth are important at all stages of life since they support human functions like breathing, speaking, and eating. In a healthy mouth, tissues are moist, odor-free, and pain-free. When we talk about a healthy mouth, we are not just talking about the teeth but also the gingival tissue, or gums, and the supporting bone, known together as the periodontium. The gingiva may vary in color from coral pink to heavily pigmented and vary in pattern and color between different people. Healthy gingiva is firm, not red or swollen, and does not bleed when brushed or flossed. A healthy mouth has no untreated tooth decay and no evidence of lumps, ulcers, or unusual color on or under the tongue, cheeks, or gums. Teeth should not be wiggly but firmly attached to the gingiva and bone. It should not hurt to chew or brush your teeth. Throughout life, teeth and oral tissues are exposed to many environmental factors that may lead to disease and/or tooth loss. The most common oral diseases are tooth decay and periodontal disease. Good oral hygiene and regular visits to the dentist, combined with a healthy lifestyle and avoiding risks like excess sugar and smoking, help to avoid these two diseases. Oral health and nutrition. What you eat and drink affects your teeth. Just like a healthy body, a healthy smile depends on good nutrition. A balanced diet with adequate nutrients is essential for a healthy mouth, and in turn, a healthy mouth supports nutritional well-being. Food choices and eating habits are important in preventing tooth decay and gingival disease. Minerals like calcium and phosphorus contribute to dental health by protecting and rebuilding tooth enamel. 2. Enamel is the hard outer protective layer of the tooth. Fun fact: enamel is the hardest substance in the human body. Eating foods high in calcium and other nutrients such as cheese, milk, plain yogurt, calcium-fortified tofu, leafy greens, and almonds may help tooth health. 2. While protein-rich foods like meat, poultry, fish, milk, and eggs are great sources of phosphorus. When it comes to a healthy smile, fruits and vegetables are also good choices since they are high in water and fiber, which balance the sugars they hold and help to clean the teeth. 2. These foods also help stimulate saliva, which helps to wash away acids in food from teeth, both neutralizing acid and protecting teeth from decay. Many fruits and vegetables also have vitamins like vitamin C, which is important for healthy gingiva and healing, and vitamin A, another key nutrient in building tooth enamel. 2. Water is the clear winner as the best drink for your teeth, particularly fluoridated water. It helps keep your mouth clean and helps fight dry mouth. Fluoride is needed regularly throughout life to protect teeth against tooth decay. 3. Drinking water with fluoride is one of the easiest and most beneficial things you can do to help prevent cavities. Water being poured into a glass. Is carbonated water a healthy choice for my teeth? According to available research, carbonated or sparkling water, although slightly more acidic than regular water, is generally fine for your teeth. 2. While it is great to replace soda with carbonated water, it should not be used as a replacement for water with fluoride. However, not all carbonated waters are created equal. Citrus-flavored waters may have higher acid levels, increasing the risk of damage to tooth enamel. A good way to help protect your teeth is to drink these in one sitting or with meals. If you prefer drinking it without food, another option is to use a straw to help the water bypass your teeth. Remember, sparkling waters that have added sugar are sugar-sweetened beverages, which increase your risk of developing tooth decay and other chronic diseases. Hand reaching into chips in a bowl, with cans of cola on the side. How snacking can affect your dental health. What you eat and how often you eat can affect your teeth. Plaque is a sticky film of bacteria that forms on teeth and, unless removed daily, this plaque builds up. Plaque bacteria use sugar from things you eat and drink to make acid that attacks tooth enamel. This acid attack can last up to 20 minutes even after you've finished eating or drinking. This is why snacking all day or sipping a sugary drink for a long period of time can lead to tooth decay. Excess intake of added sugars leads not only to tooth decay but is also associated with other health problems, including obesity, diabetes, and cardiovascular diseases. 4. Although you may not be adding that much sugar to your food, you can still be eating more sugar than you realize. This is because added sugars are often hidden. Learning about where sugar may be hiding and how to identify these added sugars can help you in this game of hide and seek. Malnutrition and oral health. Nutrition and oral health are closely related. The World Health Organization defines malnutrition as deficiencies, excesses, or imbalances in a person's intake of energy and/or nutrients. This means that malnutrition can be overnutrition or undernutrition. Dental pain or missing teeth can lead to difficulty chewing or swallowing food, which negatively affects nutrition. This may mean eating fewer meals or meals with lower nutritional value due to impaired oral health and increased risk of malnutrition. On the other hand, lack of proper nutrients can also negatively affect the development of the oral cavity, the progression of oral diseases, and result in poor healing. 5. In this way, nutrition affects oral health, and oral health affects nutrition. Eating concerns: what to eat if you have braces and orthodontic treatments, dentures, dry mouth. Oral health tips. Here are some actions you can take to support good oral health. 15. Drink fluoridated water and brush with fluoride toothpaste. Practice good oral hygiene. Brush teeth thoroughly twice a day and floss daily between the teeth to remove dental plaque. Visit your dentist at least once a year. The average person should go twice a year, even if you have no natural teeth or have dentures. Do not use any tobacco products. If you smoke, seek resources to help you quit. Limit alcoholic drinks. Some alcoholic beverages can be very acidic, resulting in erosion of tooth enamel, and those with a high alcohol content can lead to dry mouth. Also be mindful of drink mixers, many of which are high in sugar and can increase the risk of tooth decay. If you have diabetes, work to support control of the disease. This will decrease the risk for other complications, including gum disease. Treating gum disease may help lower your blood sugar level. If your medication causes dry mouth, discuss other medication options with your doctor that may not cause this condition. If dry mouth cannot be avoided, drink plenty of water, chew sugarless gum, and avoid tobacco products and alcohol. Your oral health care provider may be able to recommend over-the-counter or prescription medications to improve your dry mouth as well. See your doctor or a dentist if you experience sudden changes in taste and smell. When acting as a caregiver, help those who are not able to brush and floss their teeth independently. Chew sugar-free xylitol gum between meals and/or when you are unable to brush after a meal. Bottom line, there is no health without oral health. As growing research and studies reveal the link between oral health and overall health, it becomes more evident that taking care of your teeth isn't just about having a nice smile and pleasant breath. Studies show that poor oral health is linked to heart disease, diabetes, pregnancy complications, and more, while positive oral health can enhance both mental and overall health. Good oral hygiene and regular visits to the dentist, combined with a healthy lifestyle and avoiding risks like excess sugar and smoking, help to keep your smile and body healthy. Glossary of terms. Precision nutrition. Physician counseling a patient using a phone app on personalized nutrition recommendations. Sitting at a desk with various items including a bowl of vegetables, an apple, clipboard, and free weights. What is it? Precision nutrition may sound like a new fad diet, but it is actually a credible emerging area of research supported by the National Institutes of Health under the umbrella of precision medicine. 1-2. Precision medicine seeks to improve the personalized treatment of diseases, and precision nutrition is specific to dietary intake. Both develop interventions to prevent or treat chronic diseases based on a person's unique characteristics like DNA, race, gender, health history, and lifestyle habits. Both aim to provide safer and more effective ways to prevent and treat disease by providing more accurate and targeted strategies. Precision nutrition assumes that each person may have a different response to specific foods and nutrients, so that the best diet for one individual may look very different than the best diet for another. How often are we tempted to follow a flashy diet that a celebrity or friend promoted in helping them to lose 20 pounds or cure their diabetes? The concept of precision nutrition would discourage this practice, as our individual blueprint might require a unique dietary plan to be successful. Precision nutrition also considers the microbiome, trillions of bacteria in our bodies that play a key role in various daily internal operations. What types and how much bacteria we have are unique to each individual. Our diets can determine which types of bacteria live in our digestive tracts, and according to precision nutrition the reverse is also true. The types of bacteria we house might determine how we break down certain foods and what types of foods are most beneficial for our bodies. How does it work? Precision nutrition, also referred to as personalized nutrition, focuses on the individual rather than groups of people. Many research studies on nutrition and types of diets provide useful information for communities and the general population. High-quality nutrition studies have shown that for the average person, eating more vegetables, whole grains, and lean proteins while eating less highly processed foods made with added sugars and salt can help reduce the risk of various diseases. Yet, when studies such as the PREDICT-1 trial focus on individual responses to food, they have found substantial variations in blood responses of glucose and triglycerides even if individuals are eating identical meals. 3. The person's microbiome was found to cause variations in blood triglycerides after a meal. Non-food factors like sleep, physical activity, and time of meals also played a role in causing variations in blood levels of glucose and triglycerides after meals. 3. Therefore, an individual may see additional benefits if following personalized nutrition guidance beyond general health recommendations. Precision nutrition evaluates one's DNA, microbiome, and metabolic response to specific foods or dietary patterns to determine the most effective eating plan to prevent or treat disease. Applying precision nutrition to disease management. Medical conditions, diabetes and cholesterol checked on a medical test result form. There are specific dietary treatments based on genetic data that have been used for years: a gluten-free diet for the management of celiac disease, a lactose-free diet for those with lactose intolerance, and the avoidance of dietary phenylalanine, an amino acid in protein foods, and some artificial sweeteners, for an inherited disorder called phenylketonuria, or PKU. However, precision nutrition is in its early stages and too soon to introduce as a treatment for chronic diseases in the general population. Research is being conducted on the application of precision nutrition for obesity, metabolic syndrome, certain cancers, and type 2 diabetes, T2DM. For example, the traditional management of T2DM targets healthy lifestyle factors, exercise, diet, achieving a healthy weight, often with use of medications. Precision nutrition can further tailor diabetes management by looking closely at the following areas. 4. 5. How one's DNA may be related to the intake and metabolism of certain nutrients, which can predict how a person responds to a specific diet. The measurement of metabolites, small molecules created during the breakdown and digestion of food, that reveal a person's long-term dietary patterns, whether it be eating fruits and vegetables regularly or having a high intake of saturated fat from a daily intake of meats and butter. Precision nutrition would see if there is an association between a person's metabolic signature created by these dietary patterns and their risk of developing T2DM. The metabolic testing used with precision nutrition might help to determine how a person's body would respond to a specific diet. Discovering types of gut bacteria that help to improve blood glucose control, and implementing dietary patterns that change one's microbiome to support the growth and maintenance of these specific gut bacteria. Applying precision nutrition to specific foods. Cup of coffee. Precision nutrition examines how a person's DNA may be associated with their response to a food. One example is coffee. Ever notice how some people are unfazed after drinking cup after cup of coffee during the day, while you may feel jittery and high-strung after only one cup? Coffee beans contain plant chemicals with health benefits, but not everyone can tolerate the side effects from the caffeine content. Research has discovered genes specifically related to coffee intake. 6. These genes may determine how fast or slowly the caffeine in coffee is metabolized. They are also associated with anti-inflammatory effects and a lower risk of certain chronic diseases. Precision nutrition uses genetic data such as this to determine if an individual would benefit from drinking more or less coffee. Other factors being researched include seeing if a high intake of saturated fat may predispose an individual to weight gain, or if a high salt intake increases one's risk of developing high blood pressure. 7. However, findings from these studies have not been replicated in different populations. Challenges and considerations. The field of precision nutrition is not yet ready for prime time because of various challenges: a lack of well-designed clinical trials showing consistent results, and expensive technologies needed to collect and study an individual's DNA, gut microbiome, and response to food intake. 4. Dietary interventions such as these require high-quality evidence of their effectiveness and consistency before they may be recommended for use alongside or even to replace conventional interventions for a particular disease. There may also be differences among findings in clinical trials of the individual metabolic response to a specific diet depending on the types of tests they use. This in turn could cause variation in the personalized nutrition recommendations that are provided. Primary care physicians, registered dietitians, and other providers directly interacting with an individual need to be educated about precision nutrition, as it requires the combined joint efforts of the entire healthcare team. Despite individual differences in metabolic response to foods, personalized dietary advice should still align with general nutrition principles, e.g. eating more fruits and vegetables, consuming less added sugar from sugary drinks, limiting sodium, etc. Although private companies have started to offer genetic and microbiome testing to the public to customize diets, more research needs to be done on the effectiveness and accuracy of these tests. Ethical and legal aspects of implementing precision nutrition should also be considered, including protecting consumer privacy in the use of precision nutrition technologies and tests. It's also important to recognize that personalized approaches may be accessible to only a small segment of the population, which can widen health disparities. We must not lose sight of improving the broader food environment through effective policies, regulations, and other population-based approaches that can help make healthy food choices the default. Nutrition and immunity. Strawberries, oranges, and other berries. During the flu season or times of illness, people often seek special foods or vitamin supplements that are believed to boost immunity. Vitamin C in foods like citrus fruits, chicken soup, and tea with honey are popular examples. Yet the design of our immune system is complex and influenced by an ideal balance of many factors, not just diet, and especially not by any one specific food or nutrient. However, a balanced diet consisting of a range of vitamins and minerals, combined with healthy lifestyle factors like adequate sleep and exercise and low stress, most effectively primes the body to fight infection and disease. What is our immune system? On a daily basis, we are constantly exposed to potentially harmful microbes of all sorts. Our immune system, a network of intricate stages and pathways in the body, protects us against these harmful microbes as well as certain diseases. It recognizes foreign invaders like bacteria, viruses, and parasites and takes immediate action. Humans possess two types of immunity, innate and adaptive. Innate immunity is a first-line defense from pathogens that try to enter our bodies, achieved through protective barriers. These barriers include skin that keeps out the majority of pathogens, mucus that traps pathogens, stomach acid that destroys pathogens, enzymes in our sweat and tears that help create antibacterial compounds, immune system cells that attack all foreign cells entering the body. Adaptive or acquired immunity is a system that learns to recognize a pathogen. It is regulated by cells and organs in our body like the spleen, thymus, bone marrow, and lymph nodes. When a foreign substance enters the body, these cells and organs create antibodies and lead to multiplication of immune cells, including different types of white blood cells, that are specific to that harmful substance and attack and destroy it. Our immune system then adapts by remembering the foreign substance so that if it enters again, these antibodies and cells are even more efficient and quick to destroy it. Other conditions that trigger an immune response. Antigens are substances that the body labels as foreign and harmful, which triggers immune cell activity. Allergens are one type of antigen and include grass pollen, dust, food components, or pet hair. Antigens can cause a hyperreactive response in which too many white cells are released. People's sensitivity to antigens varies widely. For example, an allergy to mold triggers symptoms of wheezing and coughing in a sensitive individual but does not trigger a reaction in other people. Inflammation is an important, normal step in the body's innate immune response. When pathogens attack healthy cells and tissue, a type of immune cell called mast cells counterattack and release proteins called histamines, which cause inflammation. Inflammation may generate pain, swelling, and a release of fluids to help flush out the pathogens. The histamines also send signals to discharge even more white blood cells to fight pathogens. However, prolonged inflammation can lead to tissue damage and may overwhelm the immune system. Autoimmune disorders like lupus, rheumatoid arthritis, or type 1 diabetes are partly hereditary and cause hypersensitivity in which immune cells attack and destroy healthy cells. Immunodeficiency disorders can depress or completely disable the immune system and may be genetic or acquired. Acquired forms are more common and include AIDS and cancers like leukemia and multiple myeloma. In these cases, the body's defenses are so reduced that a person becomes highly susceptible to illness from invading pathogens or antigens. What factors can depress our immune system? Older age. As we age, our internal organs may become less efficient. Immune-related organs like the thymus or bone marrow produce less immune cells needed to fight off infections. Aging is sometimes associated with micronutrient deficiencies, which may worsen a declining immune function. Environmental toxins, smoke and other particles contributing to air pollution, excessive alcohol. These substances can impair or suppress the normal activity of immune cells. Excess weight, obesity is associated with low-grade chronic inflammation. Fat tissue produces adipocytokines that can promote inflammatory processes. 1. Research is early, but obesity has also been identified as an independent risk factor for the influenza virus, possibly due to the impaired function of T cells, a type of white blood cell. 2. Poor diet, malnutrition or a diet lacking in one or more nutrients can impair the production and activity of immune cells and antibodies. Chronic diseases, autoimmune and immunodeficiency disorders attack and potentially disable immune cells. Chronic mental stress, stress releases hormones like cortisol that suppresses inflammation. Inflammation is initially needed to activate immune cells and the action of white blood cells. Lack of sleep and rest. Sleep is a time of restoration for the body, during which a type of cytokine is released that fights infection. Too little sleep lowers the amount of these cytokines and other immune cells. Does an immune-boosting diet exist? Eating enough nutrients as part of a varied diet is required for the health and function of all cells, including immune cells. Certain dietary patterns may better prepare the body for microbial attacks and excess inflammation, but it is unlikely that individual foods offer special protection. Each stage of the body's immune response relies on the presence of many micronutrients. Examples of nutrients that have been identified as critical for the growth and function of immune cells include vitamin C, vitamin D, zinc, selenium, iron, and protein, including the amino acid glutamine. 3. 4. They are found in a variety of plant and animal foods. Diets that are limited in variety and lower in nutrients, such as consisting primarily of ultra-processed foods and lacking in minimally processed foods, can negatively affect a healthy immune system. It is also believed that a Western diet high in refined sugar and red meat and low the microbiome in fruits and vegetables can promote disturbances in healthy intestinal microorganisms, resulting in chronic inflammation of the gut and associated suppressed immunity. 5. The microbiome is an internal metropolis of trillions of microorganisms or microbes that live in our bodies, mostly in the intestines. It is an area of intense and active research, as scientists are finding that the microbiome plays a key role in immune function. The gut is a major site of immune activity and the production of antimicrobial proteins. 6. 7. The diet plays a large role in determining what kinds of microbes live in our intestines. A high-fiber plant-rich diet with plenty of fruits, vegetables, whole grains, and legumes appear to support the growth and maintenance of beneficial microbes. Certain helpful microbes break down fibers into short-chain fatty acids, which have been shown to stimulate immune cell activity. These fibers are sometimes called prebiotics because they feed microbes. Therefore, a diet containing probiotic and prebiotic foods may be beneficial. Probiotic foods contain live helpful bacteria, and prebiotic foods contain fiber and oligosaccharides that feed and maintain healthy colonies of those bacteria. Probiotic foods include kefir, yogurt with live active cultures, fermented vegetables, sauerkraut, tempeh, kombucha tea, kimchi, and miso. Prebiotic foods include garlic, onions, leeks, asparagus, Jerusalem artichokes, dandelion greens, bananas, and seaweed. However, a more general rule is to eat a variety of fruits, vegetables, beans, and whole grains for dietary prebiotics. Chicken soup as medicine? A warm bowl of chicken soup is a popular go-to when we're feeling under the weather. Is there scientific evidence that it aids in healing? The short answer is no. There aren't any clinical trials that show that chicken soup speeds healing any more than other foods. But when breaking down its ingredients, it does appear a worthwhile remedy to try. First of all, chicken soup is light and easy on the stomach when our appetite isn't great. Second, it provides fluids and electrolytes to prevent dehydration, which can easily occur with a fever. Lastly, a traditional chicken soup recipe supplies various nutrients involved in the immune system: protein and zinc from the chicken, vitamin A from carrots, vitamin C from celery and onions, and antioxidants in the onions and herbs. This is one tasty and soothing food to include when not feeling well and doesn't need a doctor's prescription. Do vitamin or herbal supplements help? A deficiency of single nutrients can alter the body's immune response. Animal studies have found that deficiencies in zinc, selenium, iron, copper, folic acid, and vitamins A, B6, C, D, and E can alter immune responses. 8. These nutrients help the immune system in several ways, working as an antioxidant to protect healthy cells, supporting growth and activity of immune cells, and producing antibodies. Epidemiological studies find that those who are poorly nourished are at greater risk of bacterial, viral, and other infections. Spotlight on vitamin D. Vitamin D's role in regulating the immune system has led scientists to explore two parallel research paths. Does vitamin D deficiency contribute to the development of multiple sclerosis, type 1 diabetes, and other so-called autoimmune diseases, where the body's immune system attacks its own organs and tissues? And could vitamin D supplements help boost our body's defenses to fight infectious disease, such as tuberculosis and seasonal flu? Eating a good quality diet, as depicted by the healthy eating plate, can prevent deficiencies in these nutrients. However, there are certain populations and situations in which one cannot always eat a variety of nutritious foods, or who have increased nutrient needs. In these cases, a vitamin and mineral supplement may help to fill nutritional gaps. Studies have shown that vitamin supplementation can improve immune responses in these groups. 8 to 10, low-income households, pregnant and lactating women, infants and toddlers, and the critically ill are examples of groups at risk. The elderly are a particularly high-risk group. The immune response generally declines with increasing age as the number and quality of immune cells decreases. This causes a higher risk of poorer outcomes if the elderly develop chronic or acute diseases. In addition, about one-third of elderly in industrialized countries have nutrient deficiencies. 8. Some reasons include a poorer appetite due to chronic diseases, depression, or loneliness, multiple medications that can interfere with nutrient absorption and appetite, malabsorption due to intestinal issues, and increased nutrient needs due to hypermetabolic states with acute or chronic conditions. Diet variety may also be limited due to budget constraints or lower interest in cooking for one person, poor dentition, mental impairment, or lack of transportation and community resources to obtain healthy food. A general multivitamin/mineral supplement providing the recommended dietary allowances, RDA, may be used in these cases, unless otherwise directed by one's physician. Megadose supplements, many times the RDA, do not appear justified, and can sometimes be harmful or even suppress the immune system, example as with zinc. Remember that vitamin supplements should not be considered a substitute for a good diet because no supplements contain all the benefits of healthful foods. Herbals. Several herbal supplements have been suggested to boost immune function. What does the research say? Echinacea. Cell studies have shown that echinacea can destroy influenza viruses, but limited research in humans has been inconclusive in determining echinacea's active components. Taking echinacea after catching a cold has not been shown to shorten its duration, but taking it while healthy may offer a small chance of protection from catching a cold. 11. 12. Garlic. The active ingredient in garlic, Allicin sativum, is proposed to have antiviral and antimicrobial effects on the common cold, but high-quality clinical trials comparing garlic supplements to placebo are lacking. A Cochrane review identified only one trial of reasonable quality following 146 participants. Those taking the garlic supplement for 3 months had fewer occurrences of the common cold than those taking a placebo, but after contracting the cold virus, both groups had a similar duration of illness. 13. Note that these findings are from a single trial, which needs to be replicated. T-catechins. Cell studies have shown that T-catechins such as those found in green tea can prevent flu and some cold viruses from replicating and can increase immune activity. Human trials are still limited. 2 randomized controlled trials found that green tea capsules produced less cold/flu symptoms or incidence of flu than a placebo, however both studies were funded or had author affiliations with tea industries. 14. 8 steps to help support a healthy immune system. Eat a balanced diet with whole fruits, vegetables, lean proteins, whole grains, and plenty of water. A Mediterranean diet is one option that includes these types of foods. If a balanced diet is not readily accessible, taking a multivitamin containing the RDA for several nutrients may be used. Don't smoke or stop smoking if you do. Drink alcohol in moderation. Perform moderate regular exercise. Aim for 7 to 9 hours of sleep nightly. Try to keep a sleep schedule, waking up and going to bed around the same time each day. Our body clock, or circadian rhythm, regulates feelings of sleepiness and wakefulness, so having a consistent sleep schedule maintains a balanced circadian rhythm so that we can enter deeper, more restful sleep. Aim to manage stress. This is easier said than done, but try to find some healthy strategies that work well for you and your lifestyle, whether that be exercise, meditation, a particular hobby, or talking to a trusted friend. Another tip is to practice regular, conscious breathing throughout the day and when feelings of stress arise. It doesn't have to be long, even a few breaths can help. If you'd like some guidance, try this short mindful breathing exercise. Wash hands throughout the day, when coming in from outdoors, before and after preparing and eating food, after using the toilet, after coughing or blowing your nose. Healthy eating is as delicious as it is nutritious, a feast for the senses as well as good for the body. The Healthy Eating Plate is an excellent guide for creating healthy, balanced meals, and cooking is a great way to experiment with new flavors. We offer recipes for cooking at home, whether for yourself or your friends and family, as well as recipes for larger food service operations. To get you started, we've compiled helpful suggestions for how to create a healthy kitchen. 5 quick tips to stock a healthy kitchen. 1. Produce. Choose locally grown vegetables and fruits whenever you can, and eat plenty every day. Aim for a variety of colors. Variety is as important as quantity. No single fruit or vegetable provides all of the nutrients you need to be healthy. 2. Grains. Trade in white rice for whole grains such as barley, bulgur, oat berries, quinoa, brown rice, and more. Try perusing your local grocery store's bulk bins to discover new, delicious whole grains that are often simple to prepare. 3. Protein. Rely on healthy proteins such as fresh fish, chicken or turkey, tofu, eggs, and a variety of beans and nuts. Remember to balance your plate with lots of vegetables and fruit, whole grains and healthy fats as well. 4. Fats and oils. Use liquid vegetable oils whenever possible for sautéing vegetables, stir-frying fish or chicken, and as the base of salad dressings. Good choices include canola, sunflower, corn, soybean, peanut, and olive oil. 5. Other essentials. Even a small amount of a high-quality ingredient can have a big impact on flavor. Stock your kitchen with high-quality basics like extra virgin olive oil, balsamic vinegar, fresh and dried herbs, and a variety of unsalted nuts, such as walnuts, almonds, and pistachios, and you'll have flavorful building blocks for any recipe. A note about recipe development. Some of the recipes were contributed by well-known chefs like Ming Tsai and Molly Katzin, who collaborated with Harvard University Dining Services chefs Martin Breslin and Patty Gregory. Other recipes are from the renowned Culinary Institute of America. These contributors created colorful dishes that are both healthy and delicious.